Hi, I'm Dr. Martin Bales, and welcome to another video here at Cancer Center for Healing and Center for New Medicine. And this is my esteemed colleague,
Molly Fini.
And we are here to talk to you today about some of the energetic testing we do. Molly, why don't you begin?
Okay.
Tell us a little bit about the machine you use and what you're able to detect with it.
Oh, okay, perfect. So I do the Bio-Meridan testing, or they call it here Bio-Immune Assessment, because we test for, I look for an overgrowth of abnormal cells. I'm able to find what we call the invisible. So let's say that there's a timeline of 12 years, and in 8 years, in that timeline, things that we can detect with conventional testing, like lab tests, maybe MRIs, and like different things that like just Western medical doctors that use, whether it's in the hospitals or the facilities, we can see some things that are like we call them the invisible, like because I do energy testing, so everything starts in an energetic or emotional level. That information travels to the meridians and then to the nervous system and to the cells, and the cellular levels where conventional testing is done. And so we're at the meridian level. So I can find things such as parasites, candida, different funguses, toxins, pollution, even emotional aspects of your sickness might come into play, and I can detect that. So I look for an overgrowth of abnormal cells, I look for parasites, I look for funguses, I just look for imbalances in your body and what toxins are causing those imbalances. And many times I can find things before it can be detected in blood work or other conventional means.
So from what you're saying, it's like you catch things when they're just starting to get brewing.
Yes.
Before it goes in, and then
yes.
The conventional tests of blood, urine, stool, saliva are more when things are already going,
exactly.
when they're already more of a bigger problem.
Right.
Whereas if you can find them at the levels that you're finding them,
right.
they're a lot easier to fix.
Well, yeah. So it's much easier to reverse at that point than when it gets like way down the road, like in the 9, 10, 11 year, like, oh, this has been going on for 10 years. I've been having this problem for 12 years. Well, if we could have found it in 2 or 3 years, it would have been a lot quicker and easier to reverse and treat.
Wow. And you studied extensively in China.
Oh, yes. I've been to China several times. I've studied with doctors in the Caribbean. I stayed on Nevis Island for 6 weeks. I've been all over the world in the United States with different specialists, learning, either shadowing with them or learning extensively from them.
Wow. Okay. Sounds cool. And how long is the test?
So it can be anywhere. If I'm going to do a quick test, but it's not testing every single meridian point, what I do is check the meridian pathways to see how your energy is flowing. It's kind of like chi. So it can be, I usually like an hour with the person. Sometimes I can quickly check one thing. If you said to me, Molly, I just want you to check this patient that has parasites, but we don't have time to do anything else. And if I just check them for parasites, maybe 15 minutes, but usually when the patient gets in there, they actually want to do the whole test because they're like, well, gosh, if you can find parasites, can you find, food allergies, or can you find candida, or I've been having this issue, can you look and see what that is? So in that case, I'll do the whole test. So I like to spend an hour with the patient, but I can do it quicker if we're just looking for honing in on certain things.
I think when patients get into your office and see the complexity of your equipment and your knowledge base, they want to do everything. I certainly would.
Well, yeah, because they'll start looking around and they're like, oh, because I'm a herbologist too, so they're like, oh, what do you do with these herbs, or what do you do with that, or this? And it's like when we first start talking, they're like, well, I don't want to just do that. I want to do everything. Yeah.
Wow. Okay, good. Well, thank you. I run a somewhat similar test called F-Scan, and it's similar along the lines of the parasites, bacteria and viruses, but it's like zoomed in on that. It's not near as comprehensive as what Molly does. She mentioned emotional meridian flow does nothing. It's a little bit quicker, and the main benefit is it actually tells the name of the parasite that comes up. And so I think for a patient, the best thing to do would be to see Molly typically for an hour, if not just for half an hour, to see if they have parasites, and then be able to zoom in on those parasites with the F-Scan to see what they have, and then we can both recommend treatment.
Well, that would be perfect because I can find out what treatment they need, whether it's a homeopathic, whether it's a medication specifically, and I have no way of knowing what parasite that is. I can just find out what they need to fix it, and then you can tell them what parasite, because everyone asks, well, what parasites do I have? And I'm like, well, I can tell you how to fix it and get it out of your body, but I can't tell you exactly what it is. So that's when I would have you test them to find out, well, these are the parasites you have. Yeah, that would be perfect.
No, the two work really well together. And some patients have asked, why would one at some point find something and one not find another? And, energy medicine testing, just like allopathic lab testing, is not perfect.
Right.
I detected parasites, you detected parasites on patients whose stool samples were negative, who had been...
Well, we can talk about that. The stool samples are like 90% not accurate, because most parasites are either microscopic or they live out of the intestinal linings. So if you're going to do a stool sample and it's not in there, it's like, well, most parasites, I mean, we've found parasites in the brain. We've found parasites in different organs. I found one, this guy had a big bump on his leg and they thought it was a tumor, and it was actually a nest of parasites. Well, that's not going to come out in a stool sample. No. So that's the thing, is that is pretty inaccurate. So.
I've even had patients that were scoped up, were scoped down, saw nothing, and ended up with large parasites coming out after treatment. So we're not saying our equipment's 100%. No, we're not saying that. I think together, and the more things that we do, the more accurate we're going to be.
Right, and we do, like, part of the treatment in most cases is we have them do a garlic enema during the full moon, and people don't realize, they think it sounds kind of like, hokey pokey, but the thing is parasites live in connective tissues and cell walls, and that's one of the ways that they live and they thrive, and during the full moon they release to reproduce. And so if we can get them out during that time, and we put them on medication during that time, it's a lot more effective than just doing a stool test and like, oh, well, I don't have any parasites.
Right. Yeah, that's when they're the most vulnerable. And actually, I had a patient come in who was prescribed a pharmaceutical, and on the label it even said, take during the full moon.
Oh yeah.
So the allopathic and the front are on board now with what we've been saying for how many years?
Yeah, right.
So this isn't the what was perceived as voodoo and everything before. It actually is in the Western medical community that the most effective medicines are taken during that time.
Right. Yeah. So.
So.
Well, we agree on that.
That's of course. So anyway, we hope you enjoyed our video, and if there's anything else to add.
No, that's good. I think other than just like we just work together, and some patients are confused why we would do both, but that's why. I mean, he hones in much quicker than I can. I'm more comprehensive, and I can find out what you need to do to fix it, and he can find out exactly what it is that you have.
Absolutely. So schedule a 1-hour comprehensive with Molly, and if need be, come see me.
Yes.
Thank you so much.
Thank you.
Thank you for watching.